can you measure whether this person is sane or insane?
If you believe in something, you see it happening, you start to have different feelings, and everything happening in front of you is just confirmation of your thinking and belief.
If someone comes with a patient
right.
who is a woman,
right.
and then she speaks in a man's voice,
this is the symptoms of hasad.
Yeah.
This is the symptoms of jinn, and this is the symptoms of sihr.
Some of these cases, they lead to the attempt of suicide. What do you think? Is this a man or a woman taking a gun and shooting everybody in class?
Any belief can drive people, to kill.
Bismillah ar-Rahman ar-Rahim. Dear brothers and sisters, welcome again to Dome Podcast. And today we are talking about something that is important to you and to me as well. We are talking about mental health. And today we have an honorable guest that is going to take us through the journey of mental health. Our guest today is Dr. Mohammed bin Salim Al Alawi, who is a specialist in psychiatry. Assalamu alaikum, Doctor.
Assalamu alaikum, Akhi Hatim.
How are you today?
I'm doing good.
Alhamdulillah. Doctor, today we're going to talk about mental health. And you being in the field of mental health, I'm sure we're going to get a lot of information today that is valuable for our community and society and for individuals as well.
Right.
I would like to start with a story. When I was in my early 20s, I suffered severe pain in my chest. And I went to one of the local hospitals and I met a general doctor. He examined me. And physically, everything seems to be okay. But the doctor referred me to a psychiatrist. The only issue with that is that he broke this news in front of my family. You know, as Omani families, doctor, when we go to the hospital, the entire family goes with you to the hospital.
Right.
And I had my younger siblings there. I had my parents. We even had the maid also with us in the examining room, and the doctor said there's nothing physically wrong with your son, but there's something wrong with him mentally. So I would refer him to the mental hospital. And when I was referred to the mental hospital because of good diagnosed, the doctor said just he's stressful because of studies and so on.
Right.
And he will be okay soon, just with a little bit of rest. And I took 2 weeks off, and I came back happy and relieved from every pain. So with that, doctor, I think it is important to refer to mental health specialists or doctors.
Right.
But before we start, I would like to ask you a question that might be going through a lot of people's mind, which is, what is the difference between psychology and psychiatry?
Right. Okay, so this is one of the most commonly asked questions. Now, psychiatrist is medical doctor. So we go through medical school, then 1 year internship, and then we specialize in psychiatry. We do residency training for 4 or 5 years. And then some psychiatrists would go for sub-specialization in psychiatry itself. And these specialties could be in old age psychiatry, mood disorders and anxiety, addiction, or what I've done called psychosomatic medicine or consultation liaison psychiatry.
Yes.
Right. And then one of the main differences is that the psychiatrists obviously prescribe medication, but that's not the only thing we do. And this is one of the common misconceptions about psychiatrists, that they only prescribe medication.
And maybe the fault is with the media. That's what you see in movies and in the media, that normally the psychiatrist will give you 2 pills and that's it.
Right. And maybe some of the psychiatrists,
yes,
do that. Okay, let's admit it. We are not perfect by all means. You know what? The other day I posted a story on Instagram, and I said, and that was a picture in a teaching session I had with the Oman Medical Specialty Board psychiatry residents. And in that story, I said, you know, in psychiatry, to diagnose a case, we have to look at it from biological, social, cultural, and psychological perspectives in order to make a reasonable formulation and come up with a diagnosis. And then one of my great mentor sent me a reply in Instagram on that story saying, well, that what you should do, but the reality is far from that. And I think he is right in a sense.
What was he
alluding? He was alluding.
What was he referring to?
He's referring to the fact that this what should happen when we treat any patient, not only in psychiatry, is that we should incorporate their cultural, social background, their understanding of their disease, their values.
Yes.
Right? Not only looking at them as an organism or as a machine, right? But unfortunately, because of various reasons, that what happens sometimes.
Yeah.
And we need to do something about it. Now, I derailed from your initial questions, the difference between psychologist and psychiatrist. The psychologist usually they do 4 years of bachelor in psychology. Some of them would go through master training. Some of them would do PhD in science specific area in psychology. Some of the psychologists would delve into practice more, and some of them would do both practice and science work, right?
Or maybe go to the academic field.
And
teaching.
Exactly, and go to the academic field. So, you know, there are various avenues for psychologists themselves. So, however, I would like to take this opportunity to say that psychiatrists and psychologists are one team, and we complement each other by all means.
So do you find sometimes psychologists working in hospitals?
Yes, and that's the ideal setting, that you would have psychologists working in every and each hospital.
But the work of a psychiatrist and a psychologist want to be overlapping?
To some extent, there is an overlap. That's a good question, actually.
Yeah.
So, you know, sometimes people approach psychologists. The psychologist would do the assessment and would think, hey, there is a need probably for a psychiatrist input here, for more, biomedical input for that case, because, you know, not every psychologist or counselor would have the training and accreditation to carry on a psychiatric assessment and diagnosis, right?
The reason why I'm asking you this, doctor, is because we have a lot of students who are graduating from high school.
Right.
And to them, the idea of being a psychologist,
right,
or a psychiatrist is interesting.
Right.
But they don't know how to differentiate between
right.
the two.
Right.
And maybe they want to be a psychologist, they end up being a psychiatrist,
right,
going through 7 years of medical school and then residency, and then, you know, it
right.
takes a longer period.
Right.
Maybe they were referring to being psychology.
Exactly.
So it's important for us to educate people on the difference between the two and the practices of the two fields. Now we go back to our main topic, which is mental health. And I would say that maybe 10 years ago, or 15 years ago, if you mention mental health, nobody would understand what you're saying, because people associate health with physical health only.
Right.
But they don't associate it with mental health.
Right.
So what is mental health?
Okay. Mental health, I would say it's a dynamic state of equilibrium, okay, that enables the individuals to live and abide by universal values. And basic cognitive and social skills, ability to empathize with others, ability to have harmonious relationships, fulfilling one's potentials. These are, I think, important, not mandatory, but important components of mental health. Now, I didn't say it's a state of happiness or well-being. I use the term equilibrium, and for a very important reason, because...
So, to make it easy to our viewers, what do we mean by equilibrium?
Yes.
Yeah.
So it's a state of balance, right? So you as a human, you have range of emotions.
Yes.
And these emotions are appropriate for certain contexts. It's like somebody dying, I don't expect you to laugh and, to be smiling, right? And to be in a great state of well-being.
Unless you're very happy that person passed away.
Right.
Yeah.
Right. So it's a state of balance, right? Yeah. And I forget to mention that resilience and ability to bounce back is an integral part of this definition of mental health. And it also includes the physical health and the health of your environment.
Yeah. So, Dr. Mohammed, with physical health,
right,
it can be measured.
Right.
So you go to the physician,
right,
he would take your BP,
right,
he would take your heartbeats,
right,
your blood pressure, your weight, your height,
right,
and he would check your organs, and he will be able to measure
right,
the functionality
right,
of your organs.
Right.
But when it comes to mental health,
right,
can it be measured? Can you measure whether this person is sane or insane?
Right, right. So certainly when you compare depression, for example, to
Yes.
blood pressure, it's easier to diagnose blood pressure than you diagnose depression, right?
Yes.
And the reason, as you said, there's something obvious there.
Yes.
Measurement. Obviously, the person would present with symptoms might be indicative of high blood pressure,
Yes.
but also they would do measurement, and they would go and look for other causes or secondary causes of high blood pressure.
Yes.
This is what we call hard science. When it comes to psychological and psychiatric constructs, they are quite complex, because human beings are complex.
Yes.
Right? So to capture human phenomena and to reduce it down to a metric is very challenging, because you are going to miss the bigger picture.
Yes.
So what we rely on, obviously, there are scientists and researchers and clinicians who worked for years and years to come up with diagnostic criteria, we call it. And this is like a guidance for us as psychiatrists. Like, if this person present with 1, 2, 3, okay, that might alert you that this person is suffering from depression. The cusp is, how much this sadness or depression, affecting the individual's occupational, social, personal, and relationships, and these aspects, together.
Yeah.
So, and this is the question, like, everybody feels sadness. Absolutely, we are humans. However, not everyone is clinically depressed. So it's the impairment of function.
Yes. Very well, Doctor. In the Eastern world, especially in Arabia,
right,
it's very difficult for a person to express their feelings and to express the need for help,
right,
especially when it comes to mental health,
right,
whether it is depression or other mental health.
right.
How do we deal with the taboo of talking about your mental health as an individual? How do doctors encourage people or change their perception of people about mental health, that it is okay, it is like any other disease, in your body where you need help, so you seek help. So when it comes to mental health, as doctors, how do you deal with that, doctor?
So the short answer is, one way is to have courageous people like you who had an experience with mental illness coming and talking about their experience.
Yes.
And this is scientifically proven way of destigmatizing mental disorders.
Yeah.
We call it social contact theory, where people who have experience with mental illness, recovered or they are still under treatment, they come and share their experience.
Yeah.
Right? So this is one way of doing that. Obviously, changing belief is really hard. Changing culture is really tough thing. And I'm not sure if using the term changing is the right term here. Probably we need to work with cultures and beliefs, right?
Awareness, I mean, increasing the awareness.
Increasing the awareness. But,
Yes.
there's, people have worked for years and years to find a way to raise awareness and destigmatize mental illness. So if you go and look at the literature on that, it's very massive.
Mm-hmm.
So there are I go there, for example, and I stand in front of the camera and the TV and I said, well, depression is so-and-so and it's a normal illness, and it may not change people's behavior.
Yes.
But having contact with somebody with mental health experience, power of narrative, sometimes having a contact with a relative with mental illness, looking at them, chatting with them would give them a sense of what mental illness. So that's more powerful probably than just going and, distributing pamphlets.
Dr. Mohammed, when I was in school growing up,
Right.
We have Ibn Sina Hospital,
Right.
which is a specialized hospital for mental health.
Right.
It is very rare that I hear the word Ibn Sina Hospital. I used to hear the adults talking
Right.
about that hospital, labeling it as Mustashfa al-Majaneen, the hospital of the insane. And this has, shrinked the mental health illness into only one pot,
Right.
that you are insane.
Right.
But actually, it's not the case. There's different levels and different illnesses of mental health.
Right.
Can you explain a little bit more about that? Someone who is going through a difficulty of mental health doesn't mean he's insane.
Absolutely. And I think there are a number of range of mental health problems and disorders, starting from generalizing anxiety disorder, panic disorder, probably what you experienced,
Yes.
Social anxiety disorder, mood disorders, manic depressive illness or bipolar disorder, going to schizophrenia, or in Arabic they call it مرض الفصام.
No.
And I think people, when they talk about majaneen, they refer to individuals with severe illness like schizophrenia. And one of the main symptoms of that illness is that people lose the touch with reality. So they start to believe in things that are not there. They start to be,
Like the ones who are, having the worry that someone is chasing them, someone is after them,
right?
Someone
right,
wants to
right.
kill them.
Exactly. So this lack of being in touch with reality present as madness, or people are called, they use the term majnoon, and this is unfortunately one of the main reason why people are hesitant to seek help.
Yes.
Yeah, because mental illness, psychiatrist, and a majnoon.
Dr. Mohammed, data is an important aspect
Right.
in science.
Right.
And with data, you can solve a lot of mysteries. You
Right.
can solve a lot of problems.
Right.
You'll be able to keep track. You'll be able to develop and research.
Right.
Do we have specific data for mental health illness in Oman?
Right. So I have been honored and privileged to work with a number of colleagues on getting data on the most common mental disorders, especially in people with chronic medical illnesses, because that's my area of specialty.
Yes.
So we gathered data on depression among patients with chronic skin conditions, patients with chronic inflammatory disease, bowel and inflammatory bowel disease, on patients with sickle cell disease.
Yes.
And the data are consistent in the sense that almost 1 in 4 to 1 in 3 of these people are experiencing significant depressive symptoms.
Yes.
And it's obviously more than the general population. Now, unfortunately, we don't have wide based population level data, because it's not impossible to do that, but you have to have the logistics. But I think we should aspire to do that, to have a good epidemiological basis for any intervention.
Doctor, we will take a short break and then come back and continue our discussion.
Absolutely, thank you.
Dear brothers and sisters, welcome back to Dome Podcast with me, Hatim Abdissalaam, and joining me is Dr. Mohammed Al Alawi, who is a specialist in psychiatry. Welcome back, Doctor.
Welcome back.
Doctor, a few years back, there was an incident that happened in Oman where a policeman was stabbed by an individual. And the individual who stabbed the policeman was referred to as mentally unstable. Can mental health lead to crime, Dr. Mohammed?
The short answer is it's possible. The long and complicated answer is that things should be viewed in their contexts.
Yes.
And that incident in particular, I'm not fully aware about the details of that incident. Yeah. But these kind of incidents would happen every now and then.
Yes.
Yeah.
The reason why I'm asking you this is because of the parents
right.
who have kids maybe or young adults
right.
at home who are going through some mental difficulties
right.
or illnesses.
Right.
How should they cater for the needs of their children and be able to be alert and aware of certain indications
right.
where something might go wrong? Yeah.
Okay. So I would like to answer this question, but let me clarify an important issue here.
Yes.
So people, they shouldn't misconceive what I said.
Yes.
I'm not saying mental disorders equal to crime. Okay. I'm saying under certain circumstances, a person, for example, with paranoid schizophrenia,
yes.
Not treated, they may have a very suspicious thoughts and conviction, and that might drive them to attack another individual whom they think is against them or is conspiring or trying to kill them.
Yes.
So that could happen. But again, we should be careful about the term mental illness, because people use that term loosely, unfortunately. And
yes.
if something happened, a crime or a conflict, and post in social media, people would say, "Oh, this person is mental ill." Well,
it's a two edged sword.
Exactly, it's a slippery slope,
yes,
right?
Yes.
It's a slippery slope. Most of people in prison committing crime are not mentally unwell.
Yes.
Right. So going back to your question.
Yes. The reason also why I'm bringing up this is that the public,
right,
when something like this happens,
mm-hmm.
they shouldn't interfere with their opinions.
Right.
While they don't have enough information.
Right.
Because only the specialists which are the doctors and the police, they will be able to examine and investigate and come up with a conclusion whether this person is mentally unstable or not, whether it is a crime or it's just an accident. So people should be very careful, because it has to do with other people's feelings. Both the victim and the other person have families. And when you speak without knowledge about an incident, you are hurting the feelings of other people. I would like also to talk about one aspect which is very important, which is confidentiality when it comes to mental health. Maybe there is a fear from some people not to approach doctors, not to approach mental health institution, because of how our community is very small and so attached. Everybody knows everybody. And this might be a deterrent for them to seek help. What advice can we give our listeners and viewers, Doctor?
The rule is, if I have a client coming to our clinic, or we are assessing that person, the rule is, if you are going to say anything that we think is dangerous, or you are going to harm somebody, or you are going to harm yourself, then the confidentiality will be breached, because there is risk to you and risk at others. Otherwise, confidentiality should be maintained. Unfortunately, it's imperfect word, and you would hear from time to time confidentiality has been breached, or people were discussing about certain person, and everybody knows. And in a collective society like Oman, it's hard to keep secrets and to keep such news, especially if somebody unwell or absent, or he's not coming to gathering, and everybody would ask, right, where this individual is. So
in the past few years, Dr. Mohammed, I have come across myself individuals that I know who were students sent abroad to foreign countries for a scholarship. And they lived all their life in Oman, and suddenly they're in this big city with a different environment, different culture. They are hit with the cultural shock and missing home, and they become depressed. Some of these cases, they lead to the attempt of suicide. Now parents have become worried in regards to sending their children abroad. They feel that they should study here. It is safer that they can monitor. So is there a relationship between mental health and trying to commit suicide, Doctor?
Yes. Certainly, certain mental disorder like depression increases the risk of suicide if it's not treated. Traveling abroad, moving to a new place is a stress. These are forms of stress. So in a vulnerable individual, and when I say vulnerable, probably genetically vulnerable, there is a family history of mental illness, right? There's childhood difficulties. The person is maybe introverted.
So is it inherited? Mental health illness can be inherited?
We don't use the term exactly inherited, but the genetics of the person may determine how, for example, depression presents and how this illness responds to treatment. For example, if an individual in that family has mental illness, there is higher chances for people in that family to be mentally unwell or to have mental illness. Doesn't mean that they will certainly get that mental illness.
So I understand from you, Dr. Mohammed, that mental illness is not always have to do with your surrounding or your environment.
Right.
Sometimes it can be something beyond your capability.
Right.
Yeah.
Right. So again, that's what I refer to when I say we look at biological reasons, we look at cultural, social, environmental reasons,
Yes.
and see what is deriving this person, this individual's mental dysfunction now.
Yes.
Right. By doing so, you would be able to provide a targeted intervention, and you would be able to say, hey, this man or this lady would be, or this individual would improve with this intervention, or less likely this person would improve because of the presence of this obstacle in their life, for example.
Yes.
So, yeah.
Dr. Mohammed, you have the physical illness and you have the mental illness.
Right.
Are they interlinked?
Right.
In terms of the effect?
Right.
Because sometimes you might be diagnosed with cancer, for example, God forbid,
Right.
and you might feel that maybe this is the end of your life, because of the treatment, the chemo, the pain, the suffering, the loss of hair, and so on, especially for kids and women. So how does this affect you mentally?
Right. So we cannot separate the brain from the body or the mind from the body. They are interlinked. And you cannot separate yourself from the environment. So think about it as one organism. Your environment, your brain, and your body. They are really one, and they are really interacting and affecting each other constantly, whether you notice it or not. Let me give you an example.
Yes.
We are sitting here. Try just to close your nose and stop breathing. Don't do that. How would you feel? Short of breath?
Short of breath, yes.
Uncomfortable feeling?
Yes.
So you are in constant exchange with your surrounding. Similarly, the mind and body are in constant exchange and communication. There's substantial scientific and clinical evidence that chronic medical illnesses are associated with increased incidence and prevalence of mental disorders and vice versa.
Yes.
Some of the physical treatment for medical disorders are associated with psychological and psychiatric manifestation. And in fact, this is what I do daily in my practice. I see individuals in medical and surgical setting. So they come with medical issue, but at the same time, they might have a coexisting mental disorders or a mental health symptoms as a consequence of their physical illness. So this is part and parcel of what I do every day.
Dr. Mohammed, you see patients who are normal people, and then you see patients who are in the medical team, especially during COVID-19.
Right.
The majority of the medical teams were going through a lot of stress.
Right.
Some of them, maybe they were depressed because of the rate of deaths on a daily basis. How do you deal with the medical colleagues in terms of mental health?
How do I deal with myself?
How do you deal with yourself?
Right, because it's affected me, it's affected my family, it's affected everyone. And, let's first not to pathologize every human experience.
Yes.
So we have to be careful here. COVID-19 is a global crisis.
Yes.
And it invokes anxiety, obviously. That's the appropriate reaction. To what extent? That's the question. To what extent people have anxiety or depression, or they lose sleep or become insomniac because of the COVID-19 pandemic? That's the question. And here the individual differences, the context, the nature of their life, their predisposition and vulnerability to mental illness come into play, right? Most of, we've done a study during COVID-19, and there are a number of studies done in Oman on the psychological distress among public and among healthcare professionals. And the data is the data are consistent that up to 30%, up to 30% have significant anxiety or depressive symptoms. That doesn't mean, we should be careful, doesn't mean that this anxiety and depression are of a clinical nature that needs a psychiatric or psychotherapeutic intervention, but they are significant. Now, it's quite alarming, right? And you would expect such data, such response from the public and among physicians themselves. Unfortunately, people deal differently with these adversities and they cope differently, depending on their tools, their reservoir, their family support, their past experience. Some of them would succumb to more clinical mental disorders, but it's a minority, I would say.
Yes.
But generally, they would probably recover. They would able to cope with their experience. But some of them, there's also evidence from previous pandemics and infections. And this is like international data. People have what we call post-traumatic stress disorder, like dreams and very anxious experience, reliving the death of people in front of them during their work. So it's quite something, and it is impairing.
Yes.
Now, we have been trying, this on ourselves, trying to be mindful that we are vulnerable, we are human, so we stay connected to our family, have a time off, ensuring our physical, spiritual well-being is maintained, right? And this is what we've been telling ourselves and telling our colleague. Now, during COVID-19, because you talked about data and you like data,
yes.
So we surveyed around 1,800 individuals through an online survey. 500 had a significant depressive and anxiety symptoms, and then those were invited into an intervention study. So what we've done basically is we had two groups. One group, we gave them self-help, psychological tips, and one group we allocate them to therapist-guided
These are the public or the medical teams?
So this is very interesting. So the sample included in this interventional study, which is published, general public and minority,
a mixture.
Medical, yes, exactly, a mixture. And then we looked at the impact of this intervention, either self-help or therapist-guided. Obviously, therapist-guided, because of human contact, you would expect perform better. They improved in their anxiety and depressive indices after 6 weeks of intervention. But also, we found significant improvement with self-help, which means most individuals during COVID-19 pandemic, they don't need professional intervention, right? And I probably would stop here, but we might need to discuss the value of relationships and family in sustaining individuals during adversities.
Yes. Now, Dr. Mohammed, I was just warming up. Now I'll get my big guns out we'll start now. And I want to talk about sihr, jinn, and hasad, which is magic, and jinn is jinn, and hasad is evil eye. And the relationship of these three things with mental health, because not only in our community, in many communities, there is this misconception that everything bad that happens to you, it has to do with these three things. And maybe the medical doctors are having a difficult time to convince people that not everything has to do with these three spiritual diseases, I would say. So you being in the front line dealing with patients and this, how do you deal with this? Do people come to you after going through all traditional and religious medicines, and then when they don't make it, they come to you.
Right.
And how do you deal with them?
Oftentimes, this is the case. So people would exhaust their options, and you don't blame them to some extent, because this is their understanding. This is their explanatory model of disease.
Yes.
Right. Especially when it comes to mental illness, where you don't have a broken leg or a blood coming out.
Yes.
Right. So what is this causing suddenly this individual to be isolated, behaving in this weird manner, right? So obviously people would try to explain based on their belief and culture.
Yes.
And we as mental health professionals, we should understand this.
Yes.
And we should validate to some extent their experience. And we have to be careful in this validation. But we shouldn't antagonize people because I want to form an alliance with you, right?
Yes.
With the individual, with the family, in order to help this person, because this is my ultimate goal. Now, from pragmatic, practical point of view, some people would still come to you. For example, they will take your treatment, they'll do the therapy, but also they will still continue their, traditional and belief-oriented interventions.
Let me ask
Yes.
you, sorry to cut
Yeah.
you off.
Yeah.
Let me ask you, change the question a little bit.
Yeah.
Did you ever have a patient
Mm-hmm.
who came to you, and then after diagnosis, you realize that this is not part of the medical illness? You can't do anything about it. It is something to do with these things that I've mentioned.
So the short answer is no, because I'm not sure how to differentiate
Yes.
between this is the symptoms of hasad,
Yes.
this is the symptoms of jinn, and this is the symptoms of sihr.
Yes.
There is no empirical and scientific studies done to validate these constructs.
Yes.
So from a psychiatrist perspective, we are trained in doing the psychiatric diagnosis based on these validated constructs as much as they could be, right?
Yes.
But when an individual comes with these symptoms, and unfortunately, let me say that people waste a lot of money sometime on these things.
Yes.
Right. We come, we see people they come to us thinking that they are possessed by jinn and the Hatim fil yad, and if I remove this, I will suddenly start to have jinn manifesting its action or its
But
symptoms.
looking in their perspective, if someone comes with a patient
right,
who is a woman,
right,
and then she speaks in a man's voice,
right,
to them this is alarming. This is
Right.
something that maybe it cannot be explained medically or scientifically.
right,
When you come across these type of cases,
right.
how do you deal with it?
Right.
You
So
know?
there's this entity of what we call dissociative identity disorder.
Yes.
Right. And usually it happens when the people and individual, if you remember any story of this sort, you would find that in that person's life there's significant traumatic experience that individual exposed to. Okay, and that probably the profile of that person is that they are introverted, they don't talk about their feelings, but suddenly they start to behave and act in that manner, right? So because of certain neuromuscular changes, you would notice also the change in that tone of voice.
Yes.
Right? And the family, when they see that, oh boy, this is jinn now, this manifesting itself, it's like, this is jinn. And this happened, like, family would bring videos to us showing us this, and this was what, this was the situation at home when
they become very strong, they speak in a loud voice,
right.
The personality is totally different.
Yes.
Maybe they would have some sort of abilities, in
Right.
their understanding.
Right. And you know what? Because there's something we call confirmation bias, because everyone around, and this is the power of mind, right? If you believe in something, you see it happening, you start to have different feelings, and everything happening in front of you is just confirmation of your thinking and belief, because similar situations happening probably in other contexts where they don't believe in jinn, hasad, or evil eye, right? So so we see these individuals, unfortunately, and especially when you know the person present with physical symptoms that are not explained by any medical reason, and we call it also conversion disorder or functional neurological disorder. So individual cannot move. They have like a paralysis in their limb after certain traumatic experience, and then they go to the neurologist, they go to internist, nothing wrong, their scan is normal, so what's going on, right? So the way we explain this from a psychological and psychiatric symptom, it's the translation of the physical or psychological stress into a physical complaint. And that's what I alluded to initially, that this relationship between mind and body is very mysterious, and we are just beginning to understand.
Okay, Dr. Mohammed, inshallah, will continue with our discussion after a short break. Dear brothers and sisters, welcome back to Dome Podcast with our honorable guest, Dr. Mohammed Al Alawi. Dr. Mohammed, now I want to shift to a different area, which is the concept of divorce. Divorce affects everybody in the society, and especially couples and kids. What is the effect of divorce mentally on women, children, men, especially that some of the societies or some of the communities, they stigmatize the person who is divorced, whether it is a man or a woman. And that creates, a feeling of being inferior, a feeling of rejection, a feeling of being unwanted in society. Even they want to continue their life to marry someone else, they are always stigmatized that there's a problem with this person because he's divorced. So do you deal with such cases in your clinic, Dr. Mohammed?
I haven't seen enough clients coming to our clinic in tertiary hospital with a complaint secondary to these issues. However, most of these challenges, usually people working in private in psychiatry or psychology would see these issues. But we know very well that divorce is a very traumatic experience to some people, but to some it's a redemption, and it's a
freedom.
It's the freedom.
Yes.
Right?
Yes. And that's why it is allowed. It's an exit door.
It is. And we know it is stigmatized, obviously, and for the women more in this society. We know that very well.
Doctor, I always tell people when it comes to couples who decide to go in separate ways, it doesn't mean they are evil people. It's just, it only means that they're not compatible.
Exactly.
And everybody is maybe better off with someone else than being together with this spouse.
Exactly.
And sometimes people couples live in an unhealthy relationship just for the sake of children.
Exactly.
But
and for the sake of community.
Yeah, and for the sake of community and reputation. But in reality, they are causing more damage to the children by living together instead of being in separate ways.
Absolutely. Living in a toxic environment is more detrimental for children. Both are like difficult options, like divorce for children to have divorced parent, but also living in a conflictual environment is detrimental by all means, and we see the consequence of that as well. We know people, not all of them, but people have difficulties in their adulthood, if you trace back, they have difficult and unstable upbringing and familial environment.
Yes.
That's why I think I want to comment on this. If you allow me, we should embrace the value of family. Really.
You emphasized on this more than once.
Yeah, because it's like, for example, during COVID-19 pandemic, it's like what has helped people. Obviously, there are a number of things, but the family, so the people you stay with, the people you are connected to.
Yes.
And at least for a year, I was abroad, and I saw how difficult it is to be alone. Right.
Going through the pandemic alone.
Exactly. Not myself, but also other people like elderlies.
Yes.
Who by the nature of that society, they live on their own, and their children, they moved on with their life. But this inability to visit and to connect is like drove people crazy. Really, they started to think, what am I living for?
Yeah.
Some people in their 80s, 90s, like, we want to end our life.
Move on. Yeah.
Right.
Dr. Mohammed, I'm sure you come across so many stories and incidents and cases at your clinic. Is there any incident or case that you would like to share with us for a learning purpose for our listeners?
Yeah, this is a very good question. There are a number of cases, but I would like to talk about the example where certain ideologies can drive people to death, which means in a vulnerable individual,
yes,
emulating certain extremist ideology can lead to suicide.
Give us an example.
For example, if an individual suffering from, for example, or have vulnerability for depression, okay, they have gone through difficulty in their life, in their relationships, and now they don't have any spiritual inclination or any ideologies that sustain them.
Yes.
Or meaning in their life, right? Yes. So they become nihilistic. It's like, what am I living for? Is this what God wanted me for? And then, because the interaction of all of these factors together, it would be very justifiable for that person to say, hey,
just take your life away.
Yes.
Okay.
And it's when I feel I'm derailing a little bit, but this is true for also any extremist attack we hear about.
Yes.
Right?
Yeah.
So virtually any belief can drive people, to kill.
To do something.
To kill.
Yes.
Not to do something, to kill others.
Yes.
But that individual, if you go and analyze their psyche, their personality, their thinking, their upbringing, their life experience. So putting things in a context, so any belief could be dangerous. That's why I would like to bring this home by saying, for parents and for family, you need to have discussions and chats with your children.
Yeah.
Try to listen to them, see what kind of thinking going on, what kind of ideologies they
Now
emulate.
that you mentioned children,
right,
I want to highlight a very important issue, which is bullying.
Right.
And in the United States, there were certain shooting incidents in schools due to bullying.
Right.
So a child would be bullied from time to time and build up that depression or stress, and then they would end up taking a gun and shooting everybody in class.
Right.
Can you please talk a little bit about that in terms of parents?
Right.
How should they notice these symptoms
Right.
at an early stage before something like that happens?
Okay. So, I'm a father of 7 years old
MashaAllah.
and 1.5 years old, almost
MashaAllah.
1.5. I think.
You get in trouble with
Yes,
your wife
I know,
because
I know.
you don't know the age.
I know.
We all fall into the same trap, don't worry.
So, and I always have this discussion with my wife, like, we need to have always a chat with our daughter.
Yes.
What happened at school? How are things? We always try to update ourselves in having the skills to chat with her at every stage in her life.
Yes.
Because her mentality changes, her thinking, and so we inquire about these issues in one way or another. I'll tell you an example.
Yes.
Recently, there's this Netflix series that makes it to the top called Squid Game,
Mm-hmm.
and it went viral. And then it's gruesome and it's very violent in certain aspects.
Yes.
Um,
And it became
then-
very popular.
Exactly. And then I was surprised that this 7 years old my daughter talking to me about playing Squid Game at school. It's like, what? So yeah, and then I reflected, maybe I missed something in the discussion with my daughter over the past couple of days or weeks.
Yes.
And probably I need to be more chat, I need to talk to her more, and I need to listen to her more.
Yeah.
And I think that's very important for parents to do.
Let me tell you an incident that happened to me with my kids.
Right.
Whenever there is a new Disney release,
Right.
I would watch it with my kids because I want to make sure that what they see is appropriate.
Right.
So there was a Disney film for kids animation.
Right.
It was released,
Right.
and then it was suddenly banned in the GCC
Right.
because there is a character in the
Mhm.
movie
Mm.
of a gay person.
Right.
So I said, if I block my children from watching this, they would see it in school or somewhere else or on YouTube.
Very true.
But I have to make them understand and explain to them.
Right.
So I brought the movie at home
Right.
and I said we're going to watch it together.
Right.
And the entire movie has nothing
Right.
except that part where this individual appears,
Excellent.
who is a man wearing a dress,
Right.
and I paused it.
Right.
And I asked my kids, and they are 10 and 7,
Right.
what do you think? Is this a man or a woman?
Right.
And they said, Baba, we don't know.
Okay.
Because he has beard
Right.
and he's wearing a dress.
Right.
I said, do you think this is right
Mm-hmm.
or wrong?
Right.
He said, no, Baba, this is wrong.
Right.
Should we do like them? Should we dress like them?
Mm-hmm.
And I'm trying to build the sense of what is right and what is wrong.
Right. Right.
Instead of blocking,
Right.
because you can't block.
Absolutely. Absolutely.
Because Dr. Muhammad, to be honest, today, when you buy your latest phone,
Right.
whatever it is,
Right.
you give it to your kids to do the setup for you.
Right.
They are more advanced than you.
Absolutely.
How can you block them from this vast information that is coming their way?
Yeah. I think you'll be unrealistic.
Yeah.
You'll be unrealistic.
So the easiest thing to do is to educate them, for them to be able to distinguish what is right and wrong by themselves.
And I think you are setting the basis for an important thing that we have to do
Yes.
in today's world, which is the dialogue.
Yes.
We are actually in an era of cultural wars,
Mm.
right? Different ideologies emerging, and we have, I think, to be equipped with the necessary skills to converse and to talk about them. Canceling each other won't work.
Mm.
what would work is a very rigorous debate between well-intentioned people to hear from each other,
Yes.
and to understand each other. And this is like a general statement for any, recently we heard about what happened, the controversy around the feminist movements and what's
Yes.
happening in Oman. In general, any movement, any ideology, if you are going to address it, the best way forward is to have this rigorous dialogue and debate and discussion.
Yes.
That what you did with your kids. You did not hold the stick on them or pull the gun.
Yeah.
You have that discussion, right?
Yeah.
And despite that, things are rapidly changing. And if we don't draw the basis for these kind of behaviors, I think we are going to be in a very tough spot.
Definitely.
Yeah.
Dr. Mohammed, going back to mental health,
Right.
there are two issues that I want to talk about.
Right.
They might be a little bit different,
Mm-hmm.
and they might not be applicable to our society, but in general I want to talk about, which is abuse and rape victims.
Right.
I'm not so sure in terms of data.
Right.
Do we have enough data
Right.
about abuse cases
Right.
and rape cases in Oman or not?
Okay.
And how do we deal with
let me
victims?
say, it might be the ignorance from my side that I don't have the right data, if they are available. But I think these are issues that are happening.
Mhm.
To what scale, to what extent, I'm not entirely sure. But we should be alarmed by these cases.
Yeah.
Right.
Especially when...
and we should act.
Especially in some of the Eastern communities, the victim is afraid or is feeling, that he has no dignity to appear in public, to say, to speak out, to seek help, that, he has gone through abuse.
Very true.
And maybe the surrounding, everybody says that it is normal, it is not abuse.
Right.
The person grows and thinking that what happened to me is a normal thing, that it can happen to anybody.
Yeah, I think because the concept of the aib and shame, and unfortunately the victim will remain victim and they would suffer the consequences unless there is a communal and societal effort to facilitate the means for them to come forward and speak up.
Yes.
This issue would remain a challenge, really.
Dr. Mohammed, how do we deal with the daily stress of modernity, which increases our mental health illness? How do we deal with it? Now everything is moving so fast, and whatever is happening to us from the coronavirus and everything else that is changing our lives, and maybe will change our lives, like, for example, the technology kicking in, replacing the manual jobs with robotics. This is something stressful. People think about it that, maybe after 2 years I'm going to lose my job. So how do we deal with that, Dr. Mohammed?
So stress is an inevitable part of this life.
Yes.
Suffering is or pain is an inevitable part of this life, right? However, I think we created and we built in with the capacity to triumph with different degrees, to different degrees. But I would say overall, think about your life on different dimensions. Relationships. Do you have a family? Do you have friends? Do you have good quality relationships? Ask yourself this question. The second question is, think about your job and your career, your financial stability. Think about your psychological and spiritual well-being.
Yes.
Right? That's an important and integral stabilizing force, especially during adversities. Think about your physical health, right? That's very important. Exercise, eating healthy,
Yes.
Collaborating and volunteering, helping others, but not at your expense and at your detriment. Because some people are so egalitarian, so helpful to the extent that they may damage their health to give others, and that's not necessarily right.
Yes.
And we face this frequently in our practice. People who are perfectionistic. So yeah, exactly. So the individual should look at their life at these dimensions, right? And I put them this way because this is a very pragmatic, actionable way you can analyze your life, right? Yes. If you don't have, all of them, then certainly there's a problem. If you don't have some of them, that might be fine, right? Yes. Having also something to move forward to is an important aspect of well-being. Stagnation is very stressful, as much as overworking and being overly anxious about the future. Yes. Equally, stagnation is also very stressful.
Yes. Right. Dr. Mohammed, I'm going to ask you my final question for today.
Right.
Which is a difficult question that will keep you on your toes.
Right.
So, the hormone imbalance in the human body.
Right.
When someone feels that they are in a different body, it's not the right body.
Right.
Do general doctors or specialized doctors, physicians, look at these cases, or these cases come to the mental health specialist?
Well,
can it be considered to be a mental health issue or a psychological, or a physical issue?
Yeah. Okay, so what used to be called a mental disorder, where an individual feel that they are trapped in the wrong body. Mm-hmm. Now it's not probably considered anymore as mental disorders, and the language has significantly changed. It's obviously an
from
area
the patients or from the medical team.
From both, but mainly from the medical team, because you want the aim is to validate the individual experience, right? There has been controversies about what happened after the person, changed their physique or change their identity, and what's the long-term impact. That there are data on that. However, it's a contentious and controversial issue, not only here but internationally.
Dr. Mohammed bin Salim Al Alawi, thank you very much for being with us on Dome Podcast, and we have been honored. Thank you very much for the information you provided. See you next time, inshallah.
Thank you for having me.
Dear brothers and sisters, thank you very much for watching and listening to Dome Podcast with me, your host, Hatim Al Abdissalaam. See you next time, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.